afternoon, everyone. I'm Dr. Paul Boggy, and I'm a spine surgeon with the Kale Medical Group. I did my medical school and residency at Yale, and then I did my fellowship training in spine surgery, specifically complex deformity at University of California in San Diego. It's good to be on with everyone.
So the first question is, how can a patient be prepared for minimally invasive spine surgery? Is there anything that I can do before surgery to make it more successful?
So the first question is, how can a patient be prepared for minimally invasive spine surgery? And is there anything that I can do before the surgery so it'll be more successful? So there's really two parts here. The most important thing is always expectations. And that's what you can expect in terms of, one, the recovery after surgery, and two, what the expectation would be in terms of the improvement in symptoms you were having. And I really think that's the most important. In terms of how the surgery will be more successful, I think being in the best condition, both physically, mentally, as well as medically for the surgery is important. So we want to make sure we optimize those things, whether that's with physical therapy, in-home exercises, from the physical standpoint, and then seeing your primary care doctor, cardiologist, or whatever other specialist might be necessary from the medical standpoint.
Can I still resume my medications pre and post-operation?
Next question is, can I still resume my medications pre and post-operation? And for that, it depends on which medication. So a couple of examples. One, anti-inflammatories, things like Motrin, which is ibuprofen, or Aleve, which is naproxen, we would want you to stop 7 days before the surgery, and that's mostly because of the risk of bleeding. And the corollary to that, blood thinners, same situation. For that, I would want you to see whichever specialist gave you the blood thinner. Usually that's a cardiologist, sometimes a primary care provider, and we would have to come up with a plan together of how many days before surgery to hold that and when it's okay to start it afterwards. On top of those two things, the other things that can be a concern are herbal and oral supplements. And for those, generally, I recommend holding those before surgery because some of those actually also have a blood thinning component to them. Eventually, the goal would be that you can restart all of your medications when it's safe sometime after surgery.
What type of conditions or pain may warrant spine surgery?
Next question is, what type of conditions or pain may warrant spine surgery? And for this one, there are a couple of categories that I usually go by. The first one is a category of things which can be concerning. Those are things such as spinal cord compression or weakness in a nerve distribution, whether that's in the arms or the legs. And that's something where usually surgery can be required to relieve those symptoms or prevent them from getting worse. Another type of condition where spine surgery can be very helpful is when people have arm or leg symptoms coming from the neck or the lower back, and less commonly in the mid-back. We're pretty good at making those symptoms better with spine surgery. What we do is we open up the nerves, and people have generally a very good response to that. The next category is when people have spinal deformity, and that could be something such as scoliosis. And sometimes spine surgery is warranted for that. That depends on the symptoms. And that can either be significant pain, limitations with activity, or it can be significant deformity where people can't stand up straight or look forward. And then, one of the most common things that I see is when it's neck or back pain without any of the other things we've talked about, such as the arm or leg symptoms. In that situation, spine surgery is sometimes less effective. And so for that, it's definitely a case-by-case basis, as it always is. But for that, usually that's a last resort once everything else has been tried.
Why is minimally invasive spine surgery recommended?
Next question is, why is minimally invasive spine surgery recommended? So the main reason for this is that minimally invasive spine surgery prevents dissection of the muscle. So we go between the muscle planes rather than moving the muscle all the way to the side to get down to the spine. And so the recovery afterwards is usually easier. Less pain, easier to get back on your feet, and less time until you're recovered. Now, one of the misconceptions with minimally invasive spine surgery is that it's more effective in the long run. We found that that's not really true. If you look forward 6 months or a year, people who've had minimally invasive spine surgery versus those who haven't are both doing really well. It's just those who've had minimally invasive spine surgery get to that point a lot quicker.
What are the different non-surgical methods for spine pain treatment, and how long do these last?
Next question is, what are the different non-surgical methods for spine pain treatment, and how long will these effects last? That's a very common question that I get. And again, this is one that can be broken down into categories. In the first category, I would put things such as physical therapy. And sometimes people will ask me, will physical therapy really be effective? And it's not about the act of going to physical therapy, but it's really more the strengthening the muscles that stabilize and protect the spine. So for example, for the lower back, that can be strengthening your core and your abdominal muscles. And that can help relieve some of the pain and the pressure on the nerves. And unfortunately, this is something that we have to be consistent with and continue, or the muscles get weak and the symptoms can return. The two other types of treatments that are in this category, I would say, are acupuncture and chiropractic treatments. And I've seen good to great results with both of those. Some patients don't see as much benefit, and for those I say you could try a couple of sessions, and if it's not working, then they could pivot and we could try something else. The next category, usually oral pain medications. And so those are things such as Tylenol, over-the-counter anti-inflammatories or prescription anti-inflammatories, muscle relaxers, and nerve medications if people are having nerve symptoms. And then sometimes oral steroids can also be very helpful for this. Generally, we try to stay away from these because they can have a lot of side effects. So they're much better for acute symptoms that can be treated with a short course of oral steroids. And then the next course after that, they're usually things such as injections. So these can be things such as epidural injections around the nerves, facet injections into the joints of the spine, nerve blocks, or nerve ablations. And these can be a great option. And patients will always ask, how long will these last? And that sort of depends. It depends on exactly what's going on in terms of the pathology in the spine. And second, really, whether you've had any injections before or not for the same condition. Sometimes when people get the injections for the first time, they can last for years. Once you've had a few, then we've sort of figured out how long they last for you.
How long does it typically take to recover from spinal surgery?
Next question is, how long does it typically take to recover from spinal surgery? And that depends on the extent of the surgery required. So different types of surgery on the spine go from decompressions, where we're just freeing up the nerves, and that can include things such as microdiscectomies for disc herniation, all the way to major reconstructions of the spines with multi-level fusions. And so for the smaller surgeries, people usually go home the same day. And sometimes even for 1 up to 2 level fusions, people can sometimes go home the same day, especially if it's minimally invasive, as we've mentioned before. But the full recovery can really take up to 6 months to a year. And even with the smaller surgeries, it takes time for the nerves to recover. So while most of the recovery happens early on, the full recovery does take that long. And then for the bigger deformity corrections, it really does take a year until people are back to 100%.
How soon can a patient begin physical therapy after surgery?
The next question is, how soon can a patient begin physical therapy after surgery? And as I just mentioned, for those procedures where you can go home the same day, there's no physical therapist you need to see in the hospital. And usually physical therapy begins about 4 to 6 weeks after surgery. Initially, it's mostly for range of motion, stretching, and some light strengthening. And usually around 3 months is when we start to really advance the strengthening and really work on getting you back to how you were before surgery, and then better and stronger than that. For surgeries that require you to stay in the hospital for a day or two, and then for the bigger surgeries, sometimes people will need 5 or 6 days in the hospital, especially those big deformity corrections. For those, we'll have you seen by a physical therapist in the hospital and gauge how you're doing there. And then usually you'll do some light things on your own at home, sometimes with a home physical therapist, depending on the exact situation. And then again, really ramp it up at 4 to 6 weeks with more aggressive physical therapy.
What are the potential risks and complications associated with undergoing spine surgery?
So the next question is, what are the potential risks and complications associated with spine surgery? And luckily, we've made a lot of advances recently, both in the technology and the techniques that we use for spine surgery, and so the risks and complications have both decreased significantly. The most common risk afterwards depends on what your symptoms are before. And as I mentioned earlier, when it's mostly neck and back pain, sometimes the biggest risk is that you don't get fully better. A lot of times these patients will have 50% to 70% relief of symptoms. And as I mentioned earlier, for the nerve symptoms, it can be upwards of 90-95% relief. The other risks of spine surgery are that when you fuse a segment, you can get more pressure on the level above it, because now you've created a stiff segment, and that disc can wear out over time. That depends on the person, and it can be 20 years later, but it could be as soon as 3 to 5 years later as well. Other risks and complications after spine surgery can include things such as bleeding, infection, and injury to the nerves, but those are much less common.
How long does the procedure last?
Next question is, how long does the procedure last? And as we were talking about before, with the smaller surgeries, such as the decompressions, all the way up to the big deformity corrections. So a smaller procedure, such as a kyphoplasty, where we put cement in for a compression fracture, can be as quick as 15 to 20 minutes, versus the bigger deformity correction surgery for scoliosis can take 7 or 8 hours.
How often should I follow up with my doctor post-operation?
Next question is, how often should I follow up with my doctor after surgery? And I generally see my patients for the first post-op visit 10 to 14 days after surgery, and that's mostly to check on the incision and see how things are going overall. Next, I see them back 6 weeks after surgery. Usually by then, people are doing a lot better, especially if they were having those nerve type of symptoms. Then the third visit is usually 3 months after surgery, and this is when people who've had the bigger surgeries, the fusions, are starting to feel better than they did before surgery. The next follow-up after that is generally at 6 months, and then after that at 1 year.
Are there any symptoms that would warrant immediate medical attention?
So the next question is, are there any symptoms that would warrant immediate medical attention? And yes, there definitely are a few. So as I mentioned earlier, the symptoms you get with spinal cord compression or significant compression of the nerves can be very concerning. And so if that's higher up in the neck, that can be things such as difficulty using the hands for things such as buttoning a shirt or using keys to open a door. Another one can be difficulties with balance, feeling like you're completely off balance. And a third can be bowel or bladder issues, specifically incontinence, not knowing that you have to go to the bathroom. And then the other thing that can be concerning is weakness, whether that's weakness in one nerve distribution, such as weakness with grip, weakness lifting your shoulder, weakness with lifting a leg or moving your ankle, or weakness in both extremities, whether that's upper or lower. I would say if there's significant symptoms like that, I would either be evaluated quickly, or if it's significant weakness or bowel and bladder issues, I would recommend going to the emergency room for that.
How should I manage the side effects such as swelling, soreness, or pain after surgery?
Next question is, how should I manage the side effects such as swelling, soreness, and pain after surgery? And these are all common side effects, or really effects of surgery, and I will use a combination of pain medication, anti-inflammatories, muscle relaxers, and nerve medications if necessary, depending on the procedure, along with ice and heat to take down the swelling and to calm down the soreness and to relieve the pain. The eventual goal is that as you recover from the surgery, that the symptoms go down, and eventually the goal is to get you off of all of the medications.
Are there any conditions that might worsen if I don't receive spinal surgery?
Next question is, are there any conditions that could worsen if I don't have spinal surgery? And the answer to this is similar to the what conditions or what symptoms would you want to be evaluated for quickly. So when you have spinal cord compression or nerve compression, and then you get the symptoms of that, which are difficulty with fine motor tasks, difficulty walking, imbalance, and then issues with bowel and bladder function, or weakness, those are things that can continue to get worse without treatment. However, luckily, for most conditions, including those with nerve compression but without weakness, or things such as disc bulges, arthritis, bone spurs, those don't necessarily have to get worse. And if we can make those better without surgery, then surgery is usually not required.
If I've had a herniated disc repair before, is it likely that I would need one again?
So there's a question that's asking, if I've had a herniated disc repaired before, is it likely that I'll need a repair again? So for most disc herniations and those that have needed surgery where we take a piece of the disc out, usually the piece of disc is pushing on a nerve and people are getting symptoms in the lower back, sometimes in the buttocks, and then going down into one leg usually. So often people don't need another procedure, and if they do, it's usually not for many, many years. So there's usually two things that can happen that would require another procedure. The first one is a reherniation, where another piece of disc comes out at the same level. And most of the time, we can get that better without surgery. And that's with things such as oral medications, rest, activity changes, and sometimes an injection, and sometimes a second injection. If that doesn't make it better, and there's still compression of the nerve and symptoms, then sometimes we do have to go back in there and take that second piece of disc out. And usually that's all that's needed. Now, when a piece of disc comes out and you have a disc herniation, the rest of the disc is not as healthy as the other discs or how it was before the disc herniation. So in those cases, if the new symptoms are because of degeneration of that disc, sometimes surgery is required. And that's if we can't get your symptoms better without getting to the last step, which is surgery. So those are the two reasons surgery may be required after a disc herniation.
What would you recommend for someone who has had bad bouts with sciatica?
The question is, what would I recommend for someone who's had bad bouts of sciatica? So sciatica is pain from irritation of the nerve that goes down from the back, down the buttocks, and down the back of the leg. At the bottom of your spine, so in the lumbar spine, they're numbered from L1 to L5. And the nerves that come out of there at L4, L5, and S1, they make up the sciatic nerve. So usually the treatment for it is we start with conservative, and surgery is the last option. So the things that can be helpful are anti-inflammatories if you can take them. Those are things such as Motrin, ibuprofen, naproxen. And of course, if you have issues with stomach ulcers or your kidneys, then sometimes you can't take those. If that doesn't help, the next step is usually nerve medications. That can be something such as gabapentin or Lyrica. And outside of the medications, things like physical therapy, really working on the core, the lower back, and the hips, that can really help, especially with sciatica. Now, when those two things don't work, usually the third step is to try an injection. Prior to that is usually where we get an MRI to see exactly where the nerves are pinched. And then finally, the last step, if none of those work and the sciatic nerve is being pinched as it's coming out of the spine, that's when surgery could be a potential option.
And the last question is, what are the latest advances in minimally invasive spine surgery?
And the next question is, what are the latest advances in minimally invasive spine surgery? So that's actually one of the things that I've been most excited about recently and that I've been on the forefront of. So with minimally invasive spine surgery, one of the issues is that you can't necessarily see everything. So previously, when you would open up the entire spine and take a look at it, we could see the nerves, the discs, and where everything is. But with minimally invasive spine surgery, the whole point is to not open all of that. So there have been a number of advances. Some of them include navigation, where we can use computers, or augmented reality, where we can wear a 3D headset and it will put the patient's anatomy directly over the spine where we're working, so we know exactly where the nerves are. And then the third advancement has been in robotics. And so robotic spine surgery is great at helping us put in hardware, things such as cages, screws, or rods. And so those are three advances that we've made, so we know exactly where things are, even though we can't directly see them with minimally invasive surgery. All right, so thank you everyone for joining. And if there are any questions in the future, I'd be happy to answer them. And I know this is a complex topic, and I know that this is something that can be difficult to deal with and difficult to live with, because it can make a huge difference in quality of life and in the activities that you want to do. So I totally understand that, and I just want to work with everyone to see if I can make you better.